On Daytime Buffalo, Western New York Pain Relief and Integrative Wellness Center is back with more information on how they help their patients without the use of surgery. And Buffalo Fashion Runway tells us how they're strutting their stuff in the city. It's all coming up right now on Daytime Buffalo. Good afternoon, hello, and welcome to Daytime Buffalo. I'm your host, Chelsea Lavelle. Joining me now is a friendly face to the Daytime Buffalo studio, Dr. Christian Miliotto. Hi, doctor. Thanks for joining me.
Pleasure as always.
All right. So for those who may have missed your previous interviews and appearances with us, why don't you give us an overview about Western New York Pain Relief and Integrative Wellness?
So my clinic is a practice that utilizes state-of-the-art medicine to help people achieve a higher level of healing. We're trying to break the barrier on what most people go through, understanding that there are limited things for people to achieve pain relief with medications, injections, and even surgery. And if you've failed in feeling better with things like chiropractic adjustments, PT, or acupuncture, we're the place to go. We have the most advanced treatments in terms of pain relief, accelerated healing, and actually hitting the root cause of a person's problem who's experiencing neck, back, neuropathy, and joint pain.
And what would you say sets your clinic apart is that it's trying to find treatment alternatives to surgery, right?
Yeah, and the biggest thing about us is, we customize care to the patient. So when somebody comes in, they're going to say, my feet are burning or numb. I have back pain. I have imbalance issues. What are you going to work on? Everything. We need to address everything to give that person the highest quality of life. And many people understand that whoever's listening right now who has that pain, they might feel very stagnant. I'm on a medication, it's not doing anything, injections aren't working, I don't know any of these negative side effects, and we're here to actually help that person get rid of those things and get their life back.
And why is it that important for you and beneficial to your patients?
Well, so I put my heart and soul into treatment, and it all kind of started with my grandma. I might have talked about it last time I was here. She had rheumatoid arthritis, spinal stenosis. She was starting to fall apart, and all they did was give her injections and pain meds until she had osteoporosis and ended up having to get forced back surgery. And I really dedicated my life to helping a majority of the senior community eliminate those things, understand that in the long run they're hurting themselves, and really help them get safe, natural alternative therapy that actually helps a person heal instead of masking a symptom.
Mm-hmm. Now let's talk about the difference between surgical and non-surgical spinal decompression.
Yeah, so a lot of people ask me this question all the time. What is spinal decompression? How is it working on me? How is it going to help me? Non-surgical decompression is a therapy where we can actually take the pressure off of a specific disc or joint in the spine, the head and the neck and the mid-back, to relieve the damage to that nerve. If the person has neuropathy or nerve damage or sciatica, we can eliminate that condition. If they have a disc herniation, decompression is 96% successful at helping to heal that disc, help patients with stenosis and sciatica. Where that's important is we're eliminating medications like epidurals that are not FDA approved, they should not be delivered to the spine, and they are hurting that individual over time. That's why they can only give you 4. We're also helping to eliminate the chance of surgery. Decompression is 96% successful at eliminating back surgery, medications, and injections with no negative side effects. And people need to understand that a lot of times with surgery is not fixing a condition, it's stabilizing an area. So eventually you're gonna have what's called the 10-year rule. You're going to have problems above and below where the surgery is, whether it's a fusion or otherwise, and the person a lot of times might not even get the relief that they're supposed to get in their legs from the back surgery.
Okay, all right, let's talk about how this is relating to laminectomy syndrome, and you can explain what that is.
Yeah, so I have a lot of patients who come in, they've had 1, 2, 3, and I even had one guy that had more than 40 neck and back surgeries. And one of the things they ask me is, how can you help me if I've already had a surgery done and now they're telling me I need a second or third? Well, the reason why you need that second or third is because technically the surgery may have failed. I had a patient I'm working on right now. She had a back surgery, had the disc removed, 3 weeks, perfect pain relief. She's at her desk. She has a standing desk. She bent over to pick up her computer, and when she stood up, she couldn't stand up again. Went in emergently to the hospital, got another MRI, and she had a second disc herniation, and then the disc herniation where they did the surgery had re-herniated. And the reason why is when you do that surgery, there's a hole left there. Your body has 6 months to heal that. That's the biggest problem with back surgery. Not everybody heals the same. So when we have the surgery done, if you wake up, it's clinically a success, but we don't know if that person's actually going to maintain. With our therapies, for example, after we do the decompression, we have a therapy that helps to re-educate the damaged nerve and muscle. So now we can give you pain relief, help you with balance, help strengthen that nerve. Then we have the most advanced class 4 medical laser that you can use. It penetrates into the cord and the disc to heal that disc. So I'm only working with patients for 2 months to 3 months max. We're getting 93% patient satisfaction. We have 90 to 95% improvement in symptoms with our patients. We've been able to eliminate numbness, burning, and tingling, and that person is not doing anything with negative side effects, and that's what it's really all about.
Yes. Now, you also host lunch and learn seminars, so let's talk about those.
Yeah, it's my favorite thing to do. I'm Italian, so as you can tell, I like to talk a lot. And my seminar is really an educational for me to work with people. I want people to understand you have a doctor in an office that will treat you like family, treat you with respect, and give you the care you deserve. But it's also to educate people. Many people come to me, they're on medications like gabapentin, Lyrica, or Cymbalta. They're getting injections. They don't know what half this stuff does. So we're here to educate people on why their condition developed, why it worsened, why it didn't get better, why management's not working, and then what you can do naturally and safely to effectively treat it.
Alrighty, Dr. Miliotto, thank you so much for coming in
Thank you
and
for
sharing
having
more
me.
about what you do. And viewers, their Lunch and Learn seminar is happening in March. It's completely free. To find more information, you can head over to their website at buffalopainrelief.com. Thanks again for coming in, Doctor.
Thanks for having me.